As Chief of Staff at Grove's Hospital, we've had to do a lot of preparation with the physical space of the hospital itself. So in the last few weeks, we've created a whole separate COVID patient ward with proper isolation procedures. That's required an enormous effort, not just from physicians, nurses, and administration, but also a shout out to all the maintenance people that have worked so hard on helping with that. I want to thank all of my patients that might be watching for their patience right now with all of this. We're still seeing babies for immunizations. We're still seeing pregnant women, and we're still seeing urgent consultations. So thank you for working with us on that. Any little gesture that's so much appreciated. But I did want to say one thing. Right now, I think a lot of people are becoming aware that the fight is being fought at long-term care facilities, nursing homes, and retirement homes right now. Can I just say that those people that run and work at those facilities, as well as the families of the patients there and the residents there, they need your support too. So please look out for them and be kind to them as well. The one statement that I really wanted to make is that right now we're ready. If you had asked me that 2 or 3 weeks ago, I might have said we were less ready, but now I feel we're more ready. And one of the main reasons why we've bought that valuable time is because of the response with people in the community following the direction coming from the government and public health, practicing social distancing and doing all the things they need, which is a huge sacrifice, but it's bought us such valuable time. So I want to reassure people that things are looking good at present. We don't want to be complacent. But for right now, volumes are manageable, and we've had that valuable time to prepare.
It feels like it's been 4 weeks of change, hour by hour, day by day, week by week. And finally, I think we're feeling like we've done all the preparation. We're as ready as we can be, whether there's a big wave of cases coming through or whether we just get a steady stream of cases. I think we're as ready as we can be. Palmerston and Mount Forest, we're small hospitals without much resources compared to the bigger centres. So the big issue for us has been trying to separate out the potential COVID cases from non-COVID cases in small emerges where you're thrown together in a very small area to begin with. At Louise Marshall Hospital in Mount Forest, that's been even trickier because we're currently in a temporary emergency room due to renovations. So it's taken a lot of creativity to adapt the flow for the hospital to separate our cough and fever patients from our regular emergency room patients. Right now, Palmerston and Mount Forest normally have 15 inpatient beds each, and we've ramped up to 23. Again, anticipating a possible surge in cases locally, and even to act as an overflow for Kitchener and Guelph area. Planning, the family health team has been a very important part of that. And right now, even looking forward, Mount Forest is in the process of trying to arrange getting an assessment center set up, and that will be managed partly by the family health team and by the hospital. So they have been a very important part of this. As for how long this goes on for, like everybody else, I'm going to wait to be told by the government. I think, on the microscopic local level, I feel I have some comfort dealing with it. These are big provincial and national decisions about when things start to get eased up. Community support has been really appreciated at the hospital. And I think at each of the hospitals, there's a little rock garden of kids have painted thank yous and things of appreciation. And the big thing I want to make everyone know is that the doctors and nurses are the ones that get thanked most, but really the whole hospital is doing this. The housekeeping and cleaning are working longer hours and twice as hard. Admin are having meetings from dawn till dusk every day to try and keep this going. So everyone in the hospital is really working extra hard. It's nice to be part of the ones that get thanked, but I'm always careful to make sure that it isn't just the doctors and the nurses that are really in deep in this. So really, it is like the war analogy has been used a lot, and it does feel a little bit like a war effort where everyone pitching in to do what they can. So yeah, the community support has been invaluable, and we're settling into a new normal where I think we're finding those things to occupy ourselves that maybe our grandparents were far better at than we are. In terms of, yes, some home cooking, some home gardening, games and projects that don't involve screens, and maybe some family time that is not so screen oriented.
Oh, it's a shock to anybody there or everybody. It's when is it ever going to end, eh?
We never expect it to happen here.
Everybody's scared. It's like everywhere else, it's scared. You don't know when it's going to end. Is it going to get worse?
A lot of people wearing masks and gloves just to try and protect yourself. I myself do.
I wear a mask at home all the time to stop me from eating. There 2 weeks ago, Heather and I were thinking, what can we do to get the family involved in stuff? You got the men sitting at home, the women getting the men to do all the housework, and the ladies are sitting back relaxing. And let's get them out in the driveway with chalk, doing something, thanking the responders, the essential people. And then we decided, okay, we'll go out and buy pizzas. Give them a pizza. So we decided, yeah, it's a good idea. So we started doing that. We put it on the news media. We put it on the computer. Everybody agreed with it there.
It was on social media everywhere.
We had over 150 people, driveways, windows, lawns in this small community of Mount Forest. It was unbelievable. We were at one house there. The kids came out. They were still in their pajamas. Mom was there. Dad was there. Mom was holding the baby there with just a diaper on. Nothing else. But they were so happy, and Mom was wiping her tears. She was that happy. You just had to see it. It was unbelievable how happy the people were.
We've got to continue doing what we're doing, and hopefully everybody just stays smart about it.